we had a good discussion about people's different concepts of wellness and health. There was a lot of enthusiasm for providing more opportunities and education to islanders around wellness, around health promotion and health education, things like intramural sports, promoting physical activity, helping educate people about a better diet, doing something on the island about obesity and you know, as a marker and a health risk for people not living perhaps as healthfully as they could. So a lot of enthusiasm for health education. Along those lines, there was also some interest in people having a better access to information about public health threats like swine flu and things like that people hear about, and there's all kinds of potential for fear. And is there a mechanism? What mechanism could there be to educate people better about emerging public health issues? So one of the key topics we came up with was wellness education, wellness promotion, and public health education. Also along the lines of wellness promotion was discussion about the schools and food in the schools, vending machines, cafeteria food, farms to schools, that whole range of things we could do to make sure our kids are getting healthy food. We talked some about needs assessment and how we could get information about healthcare needs on the island. I learned about, was reminded by Steve about data that is available through DSHS, the organization, the health state organization that provides medical coupons and Medicaid certificates. Then we talked about health and care and what could we do about that, what were the needs and what were the ideas. And we talked about two main areas. One was the idea of alternative funding and resourcing of care. Ideas along the idea of a local exchange currency came up again as a way of paying for health care. The idea of bartering for health care. Could you bring in a chicken or some food for your doctor or acupuncturist visit? Why not? Maybe it just needs somebody to organize that so it's not a foreign idea to the healthcare provider. We talked about free care. There's King County Project Access that I know my patients, our clinic uses in Seattle, where a bunch of different subspecialists donate a certain number of visits per week. And there's a needs assessment that's done so that that care goes to people that are documented to be low income and in need. We could probably cook up something like that on Vashon. And then we also spoke about the idea of harnessing federal money, off-island money, to subsidize the creation of a true sliding scale clinic like a community health center to serve as a medical home for people, do it Vashon style, you know, where it offers some of the complementary care that people are interested in, and where people don't have to be afraid of walking in the door for fear of bills and collection agencies. That's the gist of what we talked about. Any questions?